Good afternoon to members of the media, members of our panel, as well as you, the viewing and listening public. We invite you to yet another press conference here at the CIG TV studios on the coronavirus or COVID-19. With us on the panel today, we have His Excellency the Governor, Mr. Martin Roper, Premier the Honourable Alden McLaughlin, the Honourable Dwayne Seymour, Minister for Health, Dr. John Lee, Chief Medical Officer, and Dr. Samuel Williams Rodriguez, who is the Medical Officer of Health. Welcome to the panel. Today we're going to begin our press briefing by asking Dr. John Lee to make a statement.
Good afternoon. The preliminary results have now come back from the first tests to be done on the presence of the novel coronavirus. Of these 20 tests, there were 19 samples sent from Health City, Cayman Islands, and one referred through the Health Services Authority. All the samples have tested negative for the virus causing COVID-19. The subjects of these investigations were being informed of the results before I provided you with this information. We will be sending the test samples for confirmation onwards to CARFA, as we would normally do to a reference laboratory, in particular when there is a new test that's been being used. The tests are being run in batches, and we await the results of the next tests, which should be available within the next 36 hours or so. In addition to the 24 tests that we have previously reported, there are a further 16, so there are 40 tests outstanding, which are a mixture of samples from both Health City and the Health Services Authority. Thank you.
Thank you, Dr. John Lee. Now we'll move on to Premier McLaughlin.
Thank you. Hello, everyone. I just want to underscore the point that Dr. Lee just made, that these are preliminary results, and we ought not to get overly excited at the result until we have the confirmation from CARFA. As this challenge rolls on, obviously the caucus and the cabinet are continuing to consider various measures to continue to constrain the spread or prevent, we hope, the spread of COVID-19 through the broader community. And so I am to announce that bars will be closed as of 11:59 p.m. on Sunday the 22nd of March, and restaurants restricted to takeout and delivery as of the same date. Also, all gyms, salons, spas, and public swimming pools will also be closed as of the same date. That is, as of 11:59 p.m. on Sunday, 22nd March, for an initial period of 2 weeks. Moving on to deal with the impact, the economic impact of the virus and the measures that we are taking to help constrain its spread. I am able to announce that the government will be making a one-time emergency COVID-19 or paying a one-time emergency COVID-19 stipend to permanent financial assistance recipients, that is, the elderly persons or the disabled, seamen and veterans, and persons in receipt of ex gratia payments, to accommodate additional medical supplies and groceries. This will be a one-time payment in addition to the $850 they currently receive monthly. We will also be making a one-time emergency COVID-19 stipend payment to families presently receiving food vouchers to accommodate additional groceries and supplies. We are estimating a possible doubling in the number of families that we currently support. Current number is 311, and are budgeting to cover a 3-month period. This payment will be made on the 30th of March.
Thank you. We clearly are still living in unprecedented times, but I just want to say again that I support the measures that government is taking, and I pay tribute to the leadership of the Premier and Cabinet in dealing with this very difficult situation and taking these robust and challenging decisions which are absolutely required. And I do also want to say I think the news on the tests is preliminary, of course, but clearly they're negative at preliminary stage, so that is clearly reassuring news as of today. I have been in touch today with Baroness Sugg, who is the Minister for the Overseas Territories, and she has asked me to make sure that everybody in the islands is very aware that even though the UK itself is going through a very challenging situation, more challenging than we face currently here, the Overseas Territories are very much in the minds of UK ministers, and our commitment and responsibility to the Overseas Territories remains steadfast. I do also want to say on law enforcement, I had a long meeting with the Police Commissioner this morning. 2 points there. One, I think our law enforcement agencies and our emergency service have a strong track record of stepping up in these islands in times of challenge and difficulty, and I have no hesitation in saying that they will do so this time, and I have every confidence in them. And I do want to repeat the message about fake news and rumours. I've discussed this again with the Police Commissioner this morning, and we will do everything within the law to take action against anyone who circulates malicious rumours, which can do huge damage and create panic in these situations. And I would just urge everybody to act responsibly. I'll leave it there. Thank you.
If I might just add, the governor has reminded me in his mention of fake news that there is a bit of fake news running out there that is creating some panic, particularly panic buying. There's a rumor this morning, or there was a rumor this morning, that the cargo ships would be stopped. That is absolutely untrue. We have again discussed these matters with the supermarket owners and importers, and everything is perfectly fine with respect to bringing supplies into the Cayman Islands. There is no need for any panic buying. There is plenty of food and other supplies available, with the notable shortage of sanitizers, which I think is an issue around the world right now.
Okay. Minister Seymour.
Good afternoon, listening public. As Minister of Health, it is my duty to address you. As we, as a government, continue to listen, pay attention to all of the happenings locally and worldwide, I ask persons to please adhere to the policies we are putting in place for your own safety. We are pressing for everyone to use their good conscience and don't be selfish in respecting the suggested distance of 6 feet and the washing of hands constantly. Please check on your neighbors and especially our elderly. Also, persons who have chronic lung disease, diabetes, bronchitis, cancer, or asthma. We ask you to check on your family members and isolate them soonest as possible. I ask those persons who smoke, until it's clear, please do not put anything in your lungs that are not natural. You may well be increasing your risks. This includes vaping. I met with the private doctors and the HSA team last night, and all is in good spirit to tackle this if it heightens. The Public Health England has visited all the hospitals, the HSA lab, the DH lab. They're also very active with MRCU. And the UCOT team has been very involved here in Cayman, and we thank them for their involvement. Self-isolation is very important for a country's ability to bounce back quickly to some normalcy. This disease is not prejudice. I thank you.
If I might
Amir?
just add something unrelated, but the minister has reminded me by his reference to the importance of isolation, to the fact that we are expecting some roughly 470 students back from the UK over the course of the next few days, and many more have come from the US and North America over the course of the last week. I want to urge all of those young people not to treat this break from school as a spring break, and not to be tempted into gathering in great groups and partying the day or the night away. This is a real health threat, and not just a threat to young people themselves, but to repeat myself for the umpteenth time, a major threat to their family, their friends, particularly the older members of the community, which might be their grandmother, grandfather, uncle, or aunt. It is important, if you've come from the UK or the US or indeed anywhere else across Europe or indeed the world these days, to self-isolate. Stay alone for 14 days until you are certain that you do not have the virus and therefore cannot pass it on.
Okay. Dr. Sam, do you have something to say?
Yes, I just want to add what Dr. Lee has said. The patients that have preliminary negative results, they have been contacted and they have been asked to stay in isolation until we have a confirmatory result from CARFA. Also, that the Public Health Department have been contacting a group of patients that we have in isolation at this time daily, just to make sure that they stay in isolation and just checking on them to see how they do it clinically.
Okay. Now we open the floor to questions from the media.
Ms. Donner, may I just...
Yes,
if I
Dr.
could
Lee.
just make one point of clarification, excuse me, just because I've been asked this several times today. The Public Health Department, Dr. Williams and myself, are requesting that anybody who returns goes into isolation as per the government has said. But this would include the whole household, because if we do not isolate the whole household, then there's no point in isolating that person. So whichever household they return to, that whole household will be isolated.
Thank you, Dr. Lee. Questions? Yes.
Alpha Lewis, Caymanian Times. Mr. Premier, there are concerns that the long lines at the DVDL, or the Vehicle License Department, may cause issues for not only the staff members that have to deal with these clients, but also the clients who are lined up waiting and have to go inside in the crowded environment. Are there plans to limit the number of people that go to these government agencies?
Indeed, the matter was raised with the minister just a few minutes ago, and we are looking to see how we can best address that. I hope it doesn't result in us having to close the facility, but if another solution cannot be worked out swiftly, that's what will happen.
My second one is there's a concern of those elderly people in the homes. Are the healthcare workers that are living there, are they isolated to protect those elderly that they're taking care of, particularly in their homes?
You mean the government?
Yes.
No, we have given advice to the healthcare caregivers of what they need to do to be sure that they protect themselves, and also, more importantly, they protect the elderly that they're taking care of them. But we have not given them a directive for them to be isolated.
More questions?
Good afternoon, Reshma Raghunath, Cayman Compass. Premier, just to talk about the stipends that you mentioned, what is the amount that is going to be paid? You give us a figure for the families in need. That's 311, I think. How many seamen and veterans, elderly, are getting the extra share payments, and what those stipends are going to look like?
So the one-off emergency stipend is $425. As I said, that's on top of what they receive on a monthly basis. We have currently 1,026 recipients of permanent financial assistance. We have 841 seamen and 81 veterans.
Okay, so in terms of the payments, you said 3 months and 1 month for the veterans. Are there any plans to include the Caymanian unemployed, who, the families that have been affected by the tourism industry that has basically, as you said yesterday, collapsed?
We are gearing up NAU to be able to process applications, and the applications are processed using a means test. So we're gearing up so that they can handle those applications by phone or by email rather than having to have the face-to-face assessments that go on. So persons who are struggling will go through the same sort of means testing to determine whether or not they qualify for the assistance. And we're gearing up NAU not just in terms of personnel, but in terms of budget so they can manage these issues.
Sorry, I just want to build on that point. Is there a specific amount that has been set aside to do these things that you and the administration, your administration are planning? Can you give us an overall figure that has been planned to take care of these issues?
Well, we gave, I think that was announced previously. We gave the HSA an additional allocation of 1.1 million to help them on the preparation on the health side. Cabinet has also allocated $3 million from the disaster fund to be able to deal with contingencies arising out of this crisis.
Kevin Morales with the Cayman Compass. Mr. McLaughlin, we talked yesterday about the restrictions at the airport, which included that anybody arriving effective immediately would be isolated for 14 days. The Compass staff has received probably dozens of emails today or messages saying that they know people who've heard directly from people who came right into the airport yesterday or this morning and heard nothing about it, right? Nothing was mentioned to them. Can you talk a little bit about that and how we actually enforce that?
It is impossible for us to import. That's why we refer to it as self-isolation. We have neither the legal force nor the resources to enforce self-isolation. It's only if someone is quarantined under the public health law, having been certified as possibly infectious or contagious by the chief medical health. It used to be called the chief public health officer. The medical officer of health, I think, is the correct title now. That you go into a quarantine basis, in which case it's not voluntary anymore. You are taken somewhere and required to stay there. We do not, and we would be fooling ourselves if we think that we have the resources. No country in the world does to enforce self-isolation for people who, on the surface, appear to be perfectly healthy. We're talking about thousands of people, and we simply would not have the resources to do that, and we don't. So that's why we continue to appeal to people to do what they know is right by themselves, by their community, by their families, because they are risking the health of the entire community by not doing so. I'll say, quite frankly, that is what has spurred along our decision to close the bars and restrict the operations of the restaurants, because it is in these sorts of places that lots of people, particularly young people, will congregate during this most dangerous of times.
Is there any measure in place to even, I guess, kind of mention to people as they're coming through, if they haven't watched the press conferences or haven't been keeping track of the news, should there be immigration officers or customs officers or somebody else at the airports just letting people know, hey, this is what we recommend you do?
Yes. In fact, we're working on the messages now, right now, and we hope to have them ready for tomorrow. The flights from the UK arrive on Thursday, Saturday, and Sunday, so that we can put one of these in the hands of every person who steps off the plane, every returning resident who steps off the plane.
Mr. McLaughlin, yesterday we talked about expatriate workers, if they are without a work permit now or if they lose their jobs, et cetera, they have to leave the island. and we had talked about that government isn't prepared to, I guess, wholesale support people who need to leave the island. That there was, I guess, an emergency fund of some sort, but that that wasn't going to be, something government was going to reach to right away. Again, we've heard from several people who say, even though thousands of expatriate workers leave all the time, they prepare for it and they're able to save for it. What happens if a worker is caught by surprise and doesn't have the money to go, or needs to go to a location where they can't get into? Their airport is already shut down, something like that. What do we do in that scenario?
Right. So that is a very, very difficult question. In the first instance, their employer should step up and take responsibility for buying the ticket if that's what's keeping the person from going back. The more difficult question is, and we have some of these, many airports around the world are now closed down, and it is very, very difficult for people to get overseas. So we are going to have to continue to do an assessment of that, because obviously these people still need a roof over their head. They need to be able to live. They need to be able to eat. So we're going to obviously have to do an assessment of how many of those are in that situation, and in conjunction with their employer, seek to try to find some way to manage them. In very short order, there are going to be a lot of hotels with no guests. So finding a room for people in a contingency like that should not be that difficult.
If there's a worker who's in that scenario, should they reach out to immigration, or will immigration be reaching out to them, or how should the process work?
But it wouldn't be. I don't think it would be immigration. I mean, the responsible thing is for their employer to make the case to us, and we take the matter from there and see what can be done. I think probably the best department would be. Oh Lord, my mind's gone. My mind's gone blank completely.
Got a lot on your mind.
Blank.
Labor Department,
Community Affairs, the Community Affairs
Yeah.
Ministry, and the departments which fall under that, and we look at the matter through that way, because this is very much a humanitarian crisis, and if people have nowhere to go and can't get there, obviously we have to look after them. But we would hope that their employer does their bit to look after their staff.
Thank you.
Okay, I have a few questions that I'll be fielding from the public as well as from other news agencies that may not be here. One of the first questions that I have, Premier, is what about the men and women of Northwood and Fairbanks prisons? What preparations are being put in place for them?
Well, perhaps I could say something on that. I mean, obviously, we're very aware of the specific challenges of Northwood. And in fact, I had a meeting with the director of the prison this morning. So, I mean, contingency planning is underway, and proper precautions to the extent that we can to safeguard the staff and the prisoners are being taken. And as of now, there are no major issues of concern, but we're obviously very aware of it, and it's something that we're looking at on an active basis.
Okay, leads me to the next question, which is, are the Cuban refugees that may be detained at this point, are they being repatriated back to Cuba?
Again, I think that is being looked at as well, but they're not being repatriated at the moment, but that is one of the things that is being looked at.
Okay. The next question is the NAU getting any extra hands to ensure that those that are most in need are actually, in fact, the persons who are going to be getting the help? In other words, this person is asking about people scamming the system.
Well, people are always trying to do that. Obviously, it's even more difficult now because we have NAU staff working remotely, because we want to minimize the risk of exposure. Mm-hmm. But because we are scaling back a whole lot of non-essential services in government, we will have the capacity to redeploy staff to pick up some of the strain if that becomes necessary. As I said earlier, we are budgeting both in terms of human and financial resources on the basis that the current demand will be doubled as a result of the crisis we're in. That is, quite frankly, anybody's guess. It's a very arbitrary number, but we have to start somewhere, and this is unprecedented. So,
I have a question from Wendy at CNS. She's asking, what about work permit holders who want to leave this week who are not from places that have direct flights from here, i.e. the Philippines, India, Europe? Will they be allowed to travel through the UK given all the bans that are in place?
I mean, if I could just make a comment on that, we have already had a number of queries from people in that situation, and my office is in touch with the UK Home Office. I mean, there may be some way of waiving the requirement for transit visas for people who need to get to the UK and then go on elsewhere. So those questions are under consideration, but I can't say we've got a yes on that yet. It's being looked at in the UK.
Okay. I have some other questions, but if Reshma, you don't want to go ahead.
Dr. Lee, I just want to get back to the tests and the results that you gave us today. Now, you said they're preliminary tests. We have been accredited to do these tests. Why do you say they're preliminary and we need the CAFA clearance?
When it comes down to the fine details, the accreditation of the laboratory at the HSA does not include this particular machine and this test. It's that machine actually exists in the forensic laboratory. The place that we're doing it, the machines that we have, all the equipment we have is absolutely correct. Public Health England have come and they've looked at the processes. I think it's important to know that all of the internal checks and controls that they did in setting it up all passed perfectly normally, and all the details of those have not given any cause for concern. So not only was the HSA entirely happy at going forward, and the person that is running the PCR machine is an exceedingly experienced scientist and with abilities to run PCR, and has been doing this for many years. This is not something new, but it's just this test that is new. And because it's a test of a potentially infectious agent, that's why Public Health England were keen to see what was being done. Another issue about Public Health England coming is that we're the first UK overseas territory to do it. So it's a first. They want to see if they can replicate the models or learn from the experience that they're gaining at the HSA and across the islands to share it to the other UK overseas territories. I think Bermuda's the only other country that may be able to get there in a short space of time, but we're a first amongst the UCOTs. It is not unusual for any laboratory, well, it's normal for any laboratory which undertakes a new something or other to have it checked by somebody else. So if you take the very, very big and very well-respected laboratory at Colindale in the United Kingdom, when they started testing for COVID, they sent all of their things to another laboratory to test them until they'd done several thousands of these things and they knew that their systems were okay. So it's absolutely normal practice to do that. And it's normal practice here for us to do that. CAFA is the reference laboratory for the region. There are other countries that have got PCR machines, I think Barbados and Jamaica and a few others. So they will also be sending. Once your confidence level goes up, you may only send 1 in 10 or 1 in so many just as a check. But for the time being, because this is a new test, we're doing due diligence.
Okay, thank you for that. And still staying with those tests, we've gotten back the 20 results.
20.
I know we touched on this yesterday and you kind of skirted around it because we know who the patient is, but was the COVID-19 patient's wife among those 20? And the 20 that were tested, were they from Health City or was it a mix from the HSA and Health City?
I still don't feel at liberty to speak about any one person individually. Certainly the wife of the sadly deceased person is not a patient as well. She's just a member of the public.
So you would not be able to share
I don't
that?
feel that's reasonable, no.
Okay, I have some more questions. The next question is about how will immigration deal with people who came from medical treatment who are still recuperating and might overstay due to the ban?
We'll deal with that as humanely as we can. Obviously, we're not going to send sick people away until they've recuperated. We'll sort out whatever the issues are with immigration, with the regulations and the law to make sure that people are regularized, I think is the word that is used.
So obviously government is doing everything that they can to help everybody, but Your Excellency, there is one question that I'll repeat from yesterday because it's come back again several times today, and it's the issue of crime and how, if the issue is being taken seriously enough and what the repercussions of all the layoffs and everything else could bring about. I think people they want to hear more about how that's going to be dealt with, that could be an increase in crime.
I mean, obviously, we hope that we don't get into that situation at all, but I had a meeting with the Police Commission this morning to go through exactly that and think about scenarios and think about contingency planning. But I think the point to stress here, ultimately, the security is a UK responsibility through me as governor, and the UK has a responsibility to all its overseas territories. So we would obviously sort security out ourselves with the resources that we have here on island. But were that ever to be a question mark, the UK is obligated and has a responsibility to come and support us. So, I mean, just to say that I'm very, very aware of some of the concerns that are being expressed around that. But now we have a very stable law and order situation.
Okay. To the doctors on the panel, one person wants to find out what's happening with the unit where people who might have to be hospitalized or are gravely ill because of the coronavirus would be housed, how the plans for that are going.
Yeah, we have mentioned before the HSA and other facilities in the island are actually ready to manage cases with suspected or confirmed with coronavirus. This unit was actually an extension in case we have many cases. The unit is ready, and we are in the process also waiting for the respirators to put in the unit, but the unit is ready to start.
Okay. Dr. Lee, I know yesterday you mentioned someone asked about ventilators, and you said that they were on their way. Do we have a number?
A number of ventilators.
Yes.
Yes, I mentioned yesterday there were 4 on their way.
4. Okay. Yeah. All right. Ralph?
Yes, this question is from the Premier. I know we are in uncharted territory right now, and the solution to a lot of the issues that we are seeing will be changes in our behavior. Do we have any departments that are staffed and ready to speak with our residents and our businesses how they're going to negotiate these uncharted territory, specifically individuals trying to make it with reduced salaries, and of course businesses who are struggling to stay afloat in this economy? Do we have any departments that they can contact and get advice and assistance and how to deal with these issues?
Right. So I hope tomorrow that Minister Hugh will be able to attend the press conference then and to talk about some of the ways that government is planning to assist businesses, particularly small businesses, through these very difficult times, including, we hope, with the assistance of CIDB, the Caymanized Development Bank, soft loans. We are stretched as a team, because we are having to think about just about every aspect of life in these islands. But thankfully, we started planning quite a ways in advance for what we could see coming down the pike, and so we are fairly well advanced with a lot of the planning for these. But we know we have to provide first. For those who can't look after themselves, we've got to ensure that everybody has a roof over their head, food to eat, access to medical supplies and health care. So those are the 3 things we are planning most for. People need to keep their utilities on. I think we've worked that bit of it out. So now we have to focus on how we can keep as many businesses running as we possibly can, so that the whole country is not flat on its face, because government simply does not have the resources to do this sort of thing long term. We've got to keep the period as short as we possibly can to get through this.
Felicia.
Felicia Rankin-Solins from Radio Cayman. With so many kids now not being in school because they're closed, is there an update on how virtual or online teachings is being conducted for educational institutions?
I don't have that information readily at hand. I'll ask the Minister of Education to come on at some point and talk about that. But there are some schools I know that have been planning for this contingency for quite some time and are essentially carrying on classes. I shouldn't say as normal because it's not as normal, but as if they were still in the classroom. Not all schools are there, but I think it's probably best if I ask her to deal with that, or for me to get a proper brief on it. I don't have that detail. So.
I can tell you, Felicia, as a parent of a teenager who attends the Clifton Hunter High School, and I have nieces at John Gray, that both schools have sent out learning hubs for students where they can do virtual learning. It's a really good system, to be honest. So the parents sign up, and help the students, their child, go through, but it has their classes on there, their lessons on there. My daughter's now, she just went through her mocks, so she's in year 11 getting ready for final exams. It actually offers mock exams online. So yeah, I can answer to the two public high schools. Yeah.
Thank you.
Yes, no problem. We're all in this together, right?
Come on up here.
So I have a few other questions from the public. If someone has returned from abroad and not self-isolated, should they call the police on that person? Should the police be called on that person?
Well, no, they aren't committing a crime, at least not as a matter of law. A crime against morality, perhaps. But again, we can only urge people to do the responsible thing. And our culture needs to develop very swiftly of really isolating those people if they don't self-isolate.
Yeah,
Okay.
I think we need peer pressure and pressure from friends and family. And it comes back to that point that, you know, this is a really difficult situation. If we're going to get through it, we really need everybody to step up and support everybody else. So I'm really asking people to think very carefully about how they behave.
So in the UK, pregnant women and those over the age of 70 have been asked to self-isolate for some 12 weeks. Is that something that we might put in place here?
Well, we haven't discussed about asking them to self-isolate. We did actually been advising them to stay home as much as possible, and we are making arrangement for them to get the medication at home and also try to arrange some type of consultation, like telemedicine also, without them having to come out and go into the hospital. We are actually in the process right now of arranging especially for the elderly, to carry their medication and give them the medication a little bit more time that they normally have in order to prevent them from coming out of the house. And we are working with the NEOC in order to get the volunteers to do that. We are working out the logistics for that.
Okay. So one person wants to know, they have a family of visitors coming from the UK who obviously have been asked to self-isolate. What does that then mean for the local family? Do they have to self-isolate with them?
I think Dr.
Yes.
Lee answered that already.
Yes, they do. So anybody
Yeah.
sharing the same household, or else it's just not an effective request.
Right. Yes.
In order to try and minimize any risks.
Yeah, I think we just need to hear it over and over again. That's why
Sure,
I
I
asked.
understand. Sure.
Reshma?
Thank you.
Or,
This question is for the Premier to go back to the ban. Sorry, just to go back to the ban that you announced for bars and the restrictions on restaurants. What are the penalties? Is it the same as the $1,000 fine and the 6 months imprisonment if they breach it? And also for the students, you sent a strong warning to them not to gather. What are the penalties if they break that?
Well, this will form these provisions with respect to the restriction on the operations of restaurants and the closure of the bars will get added to the list of regulations, the COVID control regulations. So they will have the force of law, as does the restriction on more than 50 persons gathering together in one place. So yes, if you are in breach of those, you're actually in breach of the law and subject to the penalties under those regulations, which you correctly outlined just now.
Okay, just continuing on that point, I know, Governor, you met with the police commissioner. Was part of that discussion including patrols to ensure that these restrictions are being followed and to ensure that the numbers are being kept to the level that has been stipulated by government?
Absolutely. They are doing that, and yes, they have visited some establishments that may not have been acting entirely in line with the law. So, as the Premier said, the law is the law, and we have to ensure that people obey the law.
Have you had to, do you know, sorry, in that briefing, if any bars, restaurants, or any of the businesses were shut down because of breaching the law, or any offences coming out of that?
People were spoken to, but I'm not aware of any being shut down, but it's sort of somewhat academic, as that's now being overtaken by today's announcement.
If I've gotten a response from my minister with responsibility for the DVDL, Mr. Lewis. So they've already taken action. Now employees are being spaced 6 feet apart, seating for those who are waiting 6 feet apart. The written test is conducted 6 feet apart from the person who's actually doing it. We have canceled all driving tests going forward, and we're activating the online renewal of driver's licenses. A press release will follow.
There was a question in relation to the person that was on board the Cayman Airways flight, and I'd just like to say, I know you answered that question already in a previous previous press briefing, and I believe that person was not symptomatic, Dr. Samuel, if I remember you correctly saying that the person that was quarantined on the Cayman Airways flight turned out to not be they weren't showing the symptoms of coronavirus.
Well, that patient was assessed in the Accident and Emergency Department at the HSA.
Right.
And the report from the attending physician is that the symptoms of the patient were not consistent with coronavirus.
Okay. So hopefully that answers the question for those who are listening and asking about it. Premier McLaughlin, if you could touch on the considerations being given to the pension freeze. A lot of people are asking about that.
We're still having those discussions. Obviously, the people most affected by this would be people in the private sector, not the Public Service Pension Fund, but the I think it's just called the Pensions Fund Law,
Right.
which governs people in the private sector. So those services are provided by pensions providers outside of government. Mm-hmm. So we have to have the discussions with them about it, about the implications of making those changes.
Right.
So we're working on it, but we're not there yet.
Okay. Kevin?
Mr. McLaughlin, has any consideration been given to, I guess, taking some of these social restrictions a step further and just having an all-out curfew or anything like that?
Well, we don't think we need go there yet. Our response, we're trying to be rational and proportionate to the perceived risk. As of now, we have one COVID case confirmed, and that's resulted in, unfortunately, in death. But we don't have any other evidence of any community transmission. So while we are doing everything we can to change people's behaviors, so that, because we believe it is inevitable that we're going to have to deal with this. And if we change people's behaviors, we slow down the transmission or prevent the transmission of the disease. But we don't want to ratchet it up to curfew stage right now when there is no real basis to do so. Because it is difficult enough to get people to comply with provisions which are rational and proportionate. If people start to believe that we're going over the top, then we don't have enough police officers to enforce that.
Thank you for that. One of the measures that we've been talking about is, washing your hands and going to get some antibacterial hand lotion, whatever. We
Soap and water is fine too.
And soap and water is fine too.
It's actually better.
It's better. One of the things that we continue to hear about, though, is if people do want to go get some hand lotion, there are concerns about price gouging. And I understand that there is some sort of consumer protection legislation that does exist, that the name of it escapes me. Have you looked at that? Is that a concern of yours? And what can government do to make sure that prices are fair?
Well, we've had all the supermarket folk in, all the importers in. the prices of sanitizers in particular have gone through the roof because it's a question of demand and supply the world over. I don't know that we have any basis to conclude that there's any price gouging going on. Prices have gone up, but importers have to pay the prices that are being fixed elsewhere. So I don't know that well, I can be more firm that government at this point has no basis to conclude that that there's price gouging going on in Cayman.
Thank you. And I do have one for Dr. Lee before I give up the mic. Dr. Lee, you had mentioned the 4 ventilators that are on the way to Cayman, and I apologize if you've answered this in previous press conferences, but once the 4 get here, what will be the total number, and is that adequate?
Yeah, so the questions come several times in different forms. The HSA currently has 7 ventilated beds, and the reason we call them beds is because you have to have a bed. No point having a machine if there's no bed there. And if you say you've got a ventilated bed, you're saying that I've got the staff to go with it, and the whole package is available. The counts that I've previously given for the countries around the world and the comparison with Cayman are based not on specifically a ventilator bed. It's ventilator or high dependency unit, because a lot of high dependency units do other things. They don't necessarily ventilate you. They may have things like PEEP or a bird or other things to enhance. They're just terms that I was once an anaesthetist. Terms that anaesthetists use to supplement people's breathing. But it means you've got a lot more kit around the bed in order to help that person. You could sort of dialyze somebody in a high dependency bed, although you might not necessarily ventilate them. But they're very high nursing to patient ratio. So the HSA has got 7 ventilated beds. There are 4 more ventilators coming, which means they'll move to 11 ventilated beds. There is 1 ventilator on Faith, but I don't normally count that because although it can be used in the short term, they're not staffed to manage that. Although there are staff there who are able to, there's an anaesthetist, because of the way they manage their health systems, that's, as we know, is only used for short-term emergencies, and then the patient is transferred somewhere else. The Health City has 21 high dependency or ventilated beds. So that is the number. I don't have the precise breakdown of how many ventilated and how many high dependency, but there's 21. So the total is 21 plus 7 is 28, plus the 4 is 32, plus or minus the 1 that Faith has.
And are you satisfied with that number?
Yeah, as I've said before, that number far exceeds other countries' capacity. But yes, we're isolated, but still it really far exceeds that. So am I satisfied? In a crisis like this where people need hospital beds, it'd be lovely if we could build another 1,000-bedded hospital, but we can't. So we are increasing our surge capacity across the board, and all the hospitals have readied themselves for that. In addition to that, we're thinking really hard. When I say we're thinking, it just sounds like we're not doing a lot of work, but we're looking for buildings around that, should we need them, we'll be able to, and we're working towards staffing and the buildings themselves to be able to give people more medical level care than they could get at home in buildings that will need to be identified. This is not the same as quarantine. What I want to see is buildings that we can designate saying this is an emergency medical facility, essentially. Should that need arise, if we can flatten the curve enough, or if we manage to stop it, I really hope we will never need that.
Thank you.
This next question is about public transport. People are in very close confines. How's that being addressed? Will the public transport system be shut down at some point? What will happen there?
Well, that is a distinct possibility because people in very close contact with each other increase the risk of the transmission, and we all know how tight it can get on those minibuses from time to time. Mm-hmm. So, but the public also needs to exercise some discretion and some judgment about how they behave. I mean, we don't have a police officer to follow everybody around to make sure they're doing what they should be doing. So, most people have good, solid common sense, And people need to adjust their behaviors, knowing what we're dealing with in terms of this crisis.
Okay. Another question. What about companies that are choosing to keep on their employees but are keeping those on work permits instead of Caymanians? I got two questions about that.
Well, I don't have any evidence of that yet. All we've had a number of companies, businesses in the private sector, in the tourism industry, the hospitality industry, who have written to us and say, if it is 3 weeks, we're keeping on all of our staff. We're just going to pay them and send them home. No, not everybody's going to be able to do that.
Right.
But as yet, we don't have, I'm not aware of any complaints of a Caymanian who has been sent home so that a work permit holder can, or while a work permit holder is allowed to continue. Okay. But of course, not all jobs are the same. So the fact that a work permit holder is being kept on and the Caymanian sent home, it doesn't mean that there's anything discriminatory about that. Right. The work permit holder might be a manager, and the Caymanian being sent home, a server.
Right.
So you can't just say one for one.
Sure.
You got to look at it properly.
Absolutely. There's another question. Actually, no. This is some information to Felicia's question about schools. Patrice from the ministry said that government schools, specifically primary schools, have arranged paper packets, and they're continuously looking at online resources with the knowledge that not all students will have access to computers and internet. So there's an answer for you there. Any more questions from the media? Oh, Rashma, go ahead.
Thank you. Dr. Lee, I'm going back to you. The cases that we have, can you tell us how soon we're going to get the results for the 24 cases that will be tested? And apart from that, are there any other additional tests or any other additional cases that have come up since we last met yesterday?
Yeah. So
You answered that already.
yeah. So the 24 that we have we're waiting for the results of. They're going through the system now. They have to go through confirmatory checks. So even after you've gone through one lot, you have to go back to it again, and then we have to make absolutely sure that the details are just to inform you that we have to make absolutely sure that the numbers that are coming out of the machine match the numbers that have been recorded on the hospital system. So they have to be very careful. So I would imagine it's within 24 to 36 hours for the follow-up tests. Additionally, as I mentioned, that of the 24 we're awaiting, there are another 16 that have been added. So there's a total of 40 that we're now going through the system.
Okay. So the preliminary tests, they're going through a 24 to 36-hour process, and the remaining tests have to go through another 24-hour and 36-hour. So then we'll have those results tomorrow?
Yeah, so at the moment, I think Dr. Sam may know better than I, but Dr. Williams, sorry, beg your pardon. So at the moment, yesterday's were batched clearly, as you saw, at 20s. I think they're still batching in 20s. So there's I don't know, probably around a 12 to 24 hour per 20 that's appearing. But it's difficult to be hard and fast because this is a new process. Once they get into the swing of things, then their answers will come out faster. I think they're also hoping to have a robot come. I don't quite know what the robot's going to do, but that will help to automate parts of the process and speed things along. Okay. I didn't know, Dr. Williams.
Yeah, that's correct. They're doing it in batches of 20. But remember, we're getting samples regularly, not only from the HSA, but also from the private sector and also from other hospitals. So this number will continue to increase. But up to now, we're doing 40 samples that we should have a result between 24 to 36 hours. The robot that Dr. Lee has mentioned is actually to extract the samples in an automated way, which will extract it faster and will allow us to do more samples faster. And that is on our way.
There's a rider that I wish to put on all of this. We do have a limit to the amount of reagents that we currently have in order to do the testing. We are doing everything we can to get more supplies in. But like everything in this emergency, they're difficult to get hold of.
Dr. Lee or Dr. Williams, I think what's not quite clear, and still not clear to me either, is the confirmatory tests which are being sent to CARFA with respect to the 20 that we've gotten a negative result on, how long will that process take?
Yes, so that was sort of breaking news when we walked in here. So to work out those, we have to work out those details. But in general terms, I can say we normally send to CARFA. We used to have agreements to send to CARFA on Mondays and Thursdays using our courier. That courier has subsequently declined to further take the samples of COVID. So this is a really active issue. Another courier has said they would be willing to do so. So it needs to be worked out still.
Okay. I just don't want people to come tomorrow expecting for us to have the results. So
Those
We're not
are
gonna get them
going to
quickly.
take about a week.
Right.
The
Yeah.
confirmatory is
Yeah.
going to
Right.
take a while. Yeah.
Right.
That's correct.
Okay. Some persons would like either one of the doctors to address the issue of pregnant women. There's a high concern for women who are pregnant on the island and what they should be doing and how they're being prepared for.
Avoid it.
Well, we are aware that the pregnant woman should contact their obstetrician to get advice from him or her. I am aware that the HSA obstetrician are developing a plan on how to assess, and they will continue to provide service to women during pregnancy, antenatal services. They need to follow the same advice that we have give to everyone in the population. Keep your distance, hand hygiene, and in that sense, they will be okay. But I'm aware that the HSA have a plan to contact the pregnant ladies and also follow up of them. That clinic will not stop, of course.
Yeah, so Ms. Donner, we're not trying to dodge that question. It's just that there isn't enough scientific information to give you a firm and clear answer as you'd like. Mm-hmm. And in many of these situations, to be honest, a lot of the specialist areas, like let's say neurosurgery or obstetrics or whichever, they will be doing a lot more specialist and in-depth work. So in cases which become more and more specialized, please reach out to your specialist provider because they will have access to the specialist knowledge about that particular area of health. But the evidence that's come out to date has not given any specifics, hasn't said anything specifically about that group. Nothing's jumped out of the evidence that's been, the epidemiological evidence that's been looked at so far, but more will come as time passes.
Okay. Okay, if there are no more questions from the floor. You have another question, Rashma? Go ahead.
Premier, this is for you. It's kind of twofold, if I can. My first question is, in terms of the opposition, how have they been involved in this? The discussions, the meetings, the process, has there been any involvement in terms of relaying the information and how MLAs themselves, government MLAs and opposition MLAs, are treating with their own constituents in the response to this health crisis? And my second question, which I'll remember in a little bit, I'll let you answer first.
Well, the leader of the opposition is a member of the Hazard Management Executive and has been in the one meeting that was held with respect to that. These decisions that are being taken are either cabinet decisions or executive decisions that are taken by the governor. While we can have consultation regarding these matters, these are decisions, the making of regulations, and so forth, are matters for the cabinet. So the opposition is not involved in that process.
Can I add
Okay.
to that? I just need to add that from a medical perspective, we have met twice with a member of the opposition, the CMO, the HSA, hazard management, and myself, and giving them information of what we're doing and also what measure they should take to the constituents.
Okay, thank you. And I remember my question. It was one that was sent in to us. There are reports that employers are forcing employees to use their vacation time, their sick time, while we have this 2 weeks, 3 week closure situation with the bans and stuff like that. Is government aware of this? What sort of measures are in place or can be put in place to ensure that employees are not being disadvantaged while we have these bans in place?
I haven't had any complaints regarding that, but as I told a lawyer for an employer last night, informally, the labor law is still very much in effect. There's nothing that's been done to suspend the provisions of the labor law. So any employer who behaves other than in accordance with the labor law is in breach of the law.
The only other thing I would like to say about that is that if employers are forcing or asking employees to take vacation, normally vacation is paid, so that might be to their advantage.
I have another question for the doctors. This one says, will we be getting any interferon 24 from Cuba? Apparently, it's a medicine that they're using to treat positive corona patients.
I think I mean, that's not the only treatment that may be showing promise. But with all of these things, we need to allow them to go through the proper trials. When you have a new condition like this, the trials are done exceedingly speedily, especially if it's something that is already a licensed medical product, because it's much easier to do a trial like that with people. And there are combinations of what the doctors call biologics as well, drugs that affect some of the systems which just weren't around 15, 20 years ago, or just coming on the market 20 years ago, which are now regularly used to treat viral diseases and other immune conditions and cancers. Cancer is a relatively more recent thing. So there are combinations of those as well, which are showing some promise. But until such time as the medical scientific community says, yes, this is the way to go, we would wait for that guidance.
Okay. If we don't have any more questions from Kevin.
I do have one more.
We'll be back tomorrow, you know.
Mr. McLaughlin, I know. You'd be the questions just keep piling up, though, right?
Yes, they do.
And we do really appreciate everybody's time. So thank you very much. I did hear from a couple, I guess, managerial level people in their respective establishments. And they just want to clarify a couple things. The list that you had said before, it was bars, spas, a handful of others, but those will be the only ones that fall under these restrictions, right? Other establishments won't be treated the same way.
What I'm doing today is giving notice that that's what the cabinet proposes to do, because we want to give people as much notice so they can prepare. Obviously, when we are refining this, there may well be something else that's added to the list. So I don't want to give it those kinds of undertakings now.
All right, thank you. So we'll clarify, I guess, at that point. And one other question, we had somebody who had asked, when you take out a work permit for somebody, there's a repatriation fee. What happens to that, and could that potentially go toward, helping an employee get home?
We went through this yesterday. The repatriation fee is a non-refundable fee to be used in circumstances where it is impossible for the employee to get back home for one reason or another. But as I said yesterday, it is rarely ever used. Thousands of people on work permit go home every year, and others come back and forth. So in the normal course of events, we would expect the employer and or employee to have a return ticket when they come to Cayman. So it would only be in an extreme case that government would expect to draw on that fund to help send somebody back, if there is no other way.
In some of those circumstances we talked earlier about in this press conference, would those be considered possibly some of those extreme cases?
Well, I don't know. What we talked about that I agreed with you about is where persons can't get home because the airports are closed, or they can't get through the UK or the US or wherever the case may be. That's a different circumstance. We'd have to make provision for them. But, we'd really need to be convinced that the employer and the employee can't put together the ticket money, and there'll be dire consequences if they have to stay here because they have no money for food and housing and all of those things. Right. In those sort of circumstances, government would, I'm certain, pay the repatriation fee. But this is really not a decision for me. Those are administrative decisions that are taken at another level.
I must say, though, Kevin, if we think of this repatriation fee, it was always frowned upon by the Immigration Department if a person had to be sent home through that means. In terms, so I caution persons to not try to utilize that means, because it always has an adverse effect, as I've seen in the past. So I caution.
Thank you.
On the basis that the panel will be back again tomorrow, I do have 3 final questions for you.
Three final
and
questions.
Then we're going to end this. So one question is about practicing what you preach. The immigration department, you go in, the officers are all sitting 6 feet apart, but then they have clients who come in that are not 6 feet apart.
Yeah. This is all new for everyone.
Yeah.
We're constantly adjusting. Thank you for telling me that immigration is under one of the ministries I have responsibility for. So we'd certainly look into that.
Okay.
Again, that's a place where lots of people congregate. And if push comes to shove, we may have to think about seriously dialing down the level of services that we provide with respect to some of these matters. But I would hate to have to do that now with immigration, given where we are in this process. Once we get to Sunday, then I think things will calm down a lot, because the people who want to leave or need to leave should be gone on Sunday, by Sunday.
Okay. I think it was only 2 questions.
Okay.
So if that's it, we're going to wrap up the press briefing for today. We'd like to thank our panelists and, of course, you, the media, and the viewing and listening public for joining us here on CIG TV. You can watch the press conference again tonight or this evening following the news brief here on CIG Television. We'll see you back here again tomorrow.